Thank you for joining us today. Today we're going to talk about your lymphatic system and how head and neck cancer treatment can impact your lymphatic system. My name is Angela Wicker-Ramos, and over 13 years now I have been a certified lymphedema therapist and an oncology rehab physical therapist. I am the owner of a multidisciplinary cancer treatment center in Austin, Texas called Cancer Rehab and Integrative Medicine. Let's start by talking about what is your lymphatic system. Your lymphatic system has two major jobs. It is tightly integrated with your immune system as well as your circulatory system. Your lymphatic system, the first job is for it to move fluid throughout your body. You always have fluid that's moving through your tissue spaces, bringing nutrients to your cells, and your cells are dumping what they don't need back into your tissues. Your lymphatic system is the system that helps move that fluid. Also, your lymphatic system is part of your immune system in the sense that it helps you fight disease and helps eliminate any toxins. So your lymph nodes are actual filters that filter out toxins from your lymphatic fluid. This picture right here is an oversimplified picture of your lymphatic system, but why I like it is it just shows you how dense your lymphatic system is and how complex, and creating a net throughout your entire body. The dots that you see there are your lymph nodes, and the vessels are the other green highway systems that basically move fluid through your body. And here is your head and neck lymphatics. And you have over 300 lymph nodes in your head and your neck. The reason you have so many is your eyes, your nose, your mouth, your ears are all open areas where things may come into your body. So it's important that we have that filtration system to help you fight any sort of disease or infection. So if you see here, the lymph nodes in the head and neck area, everything from up above drains down. That lymphatic fluid drains down all the way to these vessels in the collarbone region. So people who have had surgery, oftentimes some musculature is removed, oftentimes a big group of lymph nodes or lymphatic vessels are removed, as well as sometimes this jugular vein down in here. So you can see how your lymphatic system can be impacted by that surgery, as well as radiation treatment. Any radiation to that area can damage the lymphatic system as well. You have groups of lymph nodes throughout your entire body, and today we're primarily going to talk about the cervical lymph nodes because those are the ones that are generally impacted by head and neck cancer treatment. But do know that there are other groups of lymph nodes in your pelvis, in your armpits, and in your deep abdominal area as well. The lymph nodes, or the cervical lymph nodes in your head and neck, drain all the fluid from your head and your neck area. Also with your lymphatic system, we talked about lymph nodes, or the filters. We also talked about the lymphatic vessels, or the highway systems that move that lymphatic fluid. But you also have a thoracic duct. That thoracic duct is a very large highway system, or a very large lymphatic vessel that runs up your abdomen. That is the major lymphatic vessel in your body. So in a moment, we're going to talk about how to stimulate your lymphatic system and how to promote a healthy lymphatic system. And you're going to notice that some of that is going to be deep breathing or stimulating the area in the abdomen. That's going to stimulate that thoracic duct. And then you have other things in your lymphatic system, including your thymus glands and your bone marrow. And the jobs of those particular things are to produce white blood cells to help you fight infection. And then your spleen is also a filter that is part of your lymphatic system as well. So what are some easy ways to promote healthy lymphatics? The first is deep breathing, which we just spoke about. That stimulates that large highway system and helps stimulate your lymphatic system to pump better, to be more efficient. Exercise. The main way your lymphatic system moves fluid through your body is by your muscles contracting and relaxing. It's not like your circulatory system that relies on your heart. You actually need movement and strong muscles to help push that fluid. So in a moment, we're going to talk in greater depth about deep breathing and about exercise and how it impacts your lymphatic system. And then staying well hydrated is imperative to help promote healthy lymphatics. All right, so I want us to take a moment and practice diaphragmatic breathing, practice stimulating that thoracic duct. So what you're gonna do, and it doesn't matter if you're standing or sitting to do this, is you're gonna place one hand up on your sternum and one hand down in your belly. And you're gonna take a deep breath in through your nose, and you're gonna think of expanding your belly out as you inhale. And then as you exhale, you're gonna think about scooping your belly button in towards your spine. That's a diaphragmatic breath. That action in itself stimulates your lymphatics. And the recommendation is generally about 5 to 10 repetitions, multiple times per day. You can do deep breathing when you're practicing yoga. You can do deep breathing when you're sitting at a traffic light, or when you're exercising, you are naturally doing deep breathing. So what is lymphedema? So let's look at the word lymphedema. We have lymph, so lymphatic. And then edema is the medical term for swelling. So lymphedema is swelling specifically because of an injury to the lymphatic system. Everyone who has had radiation and or surgery from cancer treatment is at risk for getting lymphedema. So it's important that you know the signs and symptoms and the treatment for it. And like I mentioned, lymphatic system can be injured by the lymph nodes being removed, or damage to lymphatic vessels, which most often happens because of the area of the surgery where there may be scar tissue, or an area that has had radiation can damage those lymphatic vessels. So here's a picture of lymphedema in the neck area and even up in the cheek. So you see a bit of swelling kind of consolidated in this area here. And then it's a little more subtle, but you can see a little bit of swelling up here in the cheek area too. So this is lymphedema due to head and neck cancer treatment. The first symptom is generally not swelling. The first symptom can be an achiness or a heaviness. That may mean there's some swelling in the area, but it's not enough where you can see it yet. If you experience heaviness or achiness, let your medical oncologist or your surgeon know immediately. The earlier it's diagnosed, the earlier it's treated, the far better the outcome is and the far better managed lymphedema is. And then it can be swelling the way you see it here. Some people state that they have difficulty swallowing or feeling like they have excessive drainage down the back of their throat. That could be some swelling or lymphedema as well. Please note that everyone experiences swelling after surgery and during and after radiation treatment. That's a completely normal response from your body due to that treatment. However, that swelling should gradually be reducing over time and shouldn't last more than, for most people, 3 months. Some it can linger for about 6 months, but you want to be seeing that positive trajectory of improvement and decreased swelling. If you're noticing that swelling decreasing and then all of a sudden it increases again, this may be an issue with lymphedema. So definitely reach out to your medical oncologist or your surgeon if you're noticing that. The greatest risk for getting lymphedema for anyone with cancer treatment is the first 5 years after cancer treatment. However, please keep in mind that you are at risk lifelong. These symptoms and lymphedema can present themselves 10 years after treatment, 20 years after treatment. The prognosis, unfortunately, there's not 100% cure at the moment. However, treatment is very effective. It decreases the risk of it progressing. It can significantly reduce the amount of swelling, and it can make sure that it's well managed. So early intervention is key. What factors increase your risk for getting lymphedema? Some of these factors are not within your control. They're specifically because of your cancer treatment, the treatment that is there to save your life. These factors include the stage of your cancer. So the higher the stage, the more aggressive the cancer treatment will be, meaning the more damage it may have to your lymphatic system. Inflammation or infection, the more times that people have an infection as they're healing from their treatment, or high inflammation can increase someone's risk. The number of lymph nodes that are dissected, so obviously the more lymph nodes that are removed, the more damaged the lymphatic system is. And then the amount of radiation, the location of the radiation, and the intensity of the radiation can be factors that can influence your risk for lymphedema. So the risks that we were looking at in the previous slide are, again, things that are not within your control. However, there are things that you can do in your lifestyle that can decrease your risk. The very first thing, we know that people with a higher body mass index or people who are closer to obesity have an increased risk for getting lymphedema. So what that means is maintaining a healthy body weight through a healthy lifestyle, including exercise and a healthy diet, are definitely recommended. That's also recommended to decrease your risk for recurrence as well, and also to help the efficacy of your cancer treatment. So in general, it's very beneficial to exercise and to maintain a healthy lifestyle with diet as well. But why is your lymphatic system impacted by obesity? The first thing is there is damage to the lymphatic vessels and lymphatic leakage when you have high fat cell content in your body, because your fat cells produce hormones that can damage these lymphatic vessels. Also, it can damage the lymphatic vessel's ability to pump or the lymphatic vessel's ability to contract. Lastly, when you have lymphatic fluid that's just sitting in your tissue spaces and isn't able to move, that can stimulate more fat cell growth. So it's this cycle where more swelling equals more fat cell growth equals more damage to your lymphatic system. So again, healthy lifestyle, definitely beneficial from a lymphatic health standpoint. Stretching and strengthening. When it comes to cancer treatment, any scar that's happened or radiation, any tightness in the tissues from radiation treatment can create a barrier to lymphatic circulation. So stretching as early as is safe. Get cleared by your surgeon before you start a stretching program, because you need to make sure that that area of surgery or that area of radiation is healed before you start stretching. However, whenever you've been cleared by your surgeon, start a stretching program. That is going to soften that scar tissue, soften that area of radiation, and allow for better circulation of your lymphatics. So in this picture, it's just a demonstration of some neck stretches. Again, working in a pain-free range and getting the approval of your surgeon before you start. But I just wanted to show you some examples of some neck stretches. And it does say 30 to 60 seconds of hold. That's important because any area that has a scar or any area that's had radiation needs to be held in a stretch for an extended period of time in order to really change the elasticity of the tissues to improve your lymphatic circulation. And then this next picture is just the gentleman doing shoulder rolls, up, back, and down. Shoulder rolls just helping with posture and helping with circulation. Exercise and lymphedema. Remember how in the beginning of this presentation we talked about how your lymphatic system moves fluid through your body by your muscles contracting and relaxing, and by you deep breathing. And so exercise, it would make sense, would be very important for your lymphatic system. Do not be scared to start an exercise program if you're at risk for lymphedema. It is beneficial. You want to start off slowly, you want to listen to your body, and you want to gradually progress. But you definitely want to exercise. There has been a study back in 2008, so it's an older study, but it demonstrated that lymph flow increases by 5 times in the first 15 minutes of exercise. So that's pretty significant. And then strength training, if you have lymphedema or if you're at risk for lymphedema, strength training is very important and helpful. We know that exercise promotes that circulation. If you are sedentary or you have not exercised since your cancer diagnosis, know that there are specialists out there to help you safely get back into an exercise program, such as oncology specialized physical therapist. So if you are a little nervous or don't feel ready to get into an exercise program on your own, you need a bit more guidance, definitely reach out to your medical team and ask for a referral to an oncology physical therapist to help you safely get back into exercise. General guidelines for lymphatic health. The first is to reduce your risk for infection. Reducing your risk for infection means if you get a cut or a scratch or a burn, keep it clean, take care of it and watch for signs of infection, which include heat, fever, redness, pain, or streaking. Do not restrict any area of your body to cut off circulation. So specifically for head and the neck, that would be, you know, a tight necklace or tight arm sleeves. You want to just be cautious of anything that creates too much restriction in the head and neck region, and then avoiding excessive redness or inflammation to the head and neck. I know you guys are very aware already to be cautious in the sun after radiation treatment, but from a lymphatic standpoint, that is important as well. So treatment for lymphedema. The gold standard treatment for lymphedema is called complete decongestive therapy. And it encompasses all of these different things, including education. A lot of that education is what we've gone over today. Manual lymphatic drainage, that's a massage technique that helps move fluid out of the area of congestion or out of the area where you have swelling. It moves fluid to areas where your lymphatics are intact and where your lymphatics are working. Manual lymph drainage also increases that pumping action of your lymphatic system as well and helps soften any scar tissue or any tightness you may have. Compression. Compression can present itself as a garment, a compression garment. And Jacki, at the end of our presentation today, is going to have a picture of her compression garment so you can see kind of what that looks like. And then decongestive exercises, as we spoke about before, exercises that help move fluid through the body. So that is the gold standard treatment for lymphedema. There are other treatments that can be included in conjunction with complete decongestive therapy. That can include a compression pump, which is a pump device that helps move fluid. Say when you can't go in to see your lymphedema therapist, you can have a pump for home use. There's also other things like kinesio tape or elastic taping that helps reroute or move fluid and soften any tightness in the tissue. So there are other treatments as well, but this complete decongestive therapy is the gold standard for treatment and then management of lymphedema. So I would like to next introduce Jacki. Jacki is a head and neck cancer survivor, and she has dealt with lymphedema, and she wants to share her story about how lymphedema has impacted her and what her treatment has been like.
Thank you very much, Angela. I appreciate the opportunity to share my story a bit. As far as the diagnosis of my cancer, I think a long story short is just to say it took too long to get to the diagnosis. It all started with a bite to my tongue, and a year and a half later, I was still bouncing from one practitioner to another. In early 2015, I was referred to a dermatologist for what they thought might be a possible autoimmune disorder called lichen planus. That dermatologist at UC Davis did not think that that's what the lesion on my tongue looked like. And so she asked for slides from a biopsy that had been done 3 months earlier, which was shown to be benign. Lo and behold, that lab had missed the cancer. It had been there all along. So we had just lost several months in treatment. However, once the diagnosis was made in March of 2015, very quickly, we went into treatment mode. The first stage of that was a partial glossectomy in April of 2015. When I went in for my pre-op appointment, I weighed 103 pounds, and I had lost about 18 pounds over the course of that year trying to get the diagnosis because eating was so difficult due to the tongue lesion. But the surgery was successful, and clean margins were obtained, and no further treatment was required. This just kind of shows to the left what a typical day in my tongue journey was during 2014. A lot of inflammation and redness, sometimes bumps, sometimes white bumps, but very painful, difficult to talk, eat. And on the right side is a photo a few days after the glossectomy. So the lesion had been removed and the healing process was underway. My first metastasis of my cancer was a couple of years later. In early 2017, I had been hospitalized in Sacramento, California, for a bacterial blood infection after a severe mastoiditis, an ear infection. A few months later, we had moved to Austin, Texas, and that one enlarged lymph node had just not resolved after that episode. So my physician in California recommended I get in as quickly as possible to an ENT in Austin, who did a needle biopsy, which was inconclusive. So we had to make the decision to go ahead and have a surgical biopsy done to confirm the diagnosis that the squamous cell carcinoma was now in the lymph nodes. In October 2017, I was able to have a neck dissection done at MD Anderson in Houston. And so it was important to us to be at MD Anderson now that we were only 3 hours away from a world-renowned treatment center. Unfortunately, it was at the same time of Hurricane Harvey going on. So we had a couple of very stressful weeks trying to get into care there. But eventually that did happen. My surgery was in early October. They removed, I think it was about 34 lymph nodes, and did find through pathology that additional nodes were affected by the cancer. After about a month of recovery from surgery, I started radiation treatment, and we temporarily moved to Houston so I could be there for the full 6 weeks, 5 treatments a day for a total of 30 treatments. And these pictures just kind of show through the journey. Upper left-hand photo shows right after I'd had the lymph node removed to get the diagnosis. Quite a bit of swelling there just from removing one node. And then the bottom left is about a week after my neck dissection surgery. I still had the drain in. We were back in Austin, and I had my local physician remove that drain. And then a month later, here I am with my radiation treatment garb on. They create a mask for each patient that's specific to the facial shape and shoulders and so forth, so you can be clamped down on the table with very little movement, well, no movement during treatment, so the radiation can be as targeted as possible. So as far as lymphedema, 3 to 4 months post-surgery, I started noticing quite a bit of swelling in my face, and initially thought perhaps it was just post-surgical, but it certainly had been enough time, had been allowed since surgery, that I began to think perhaps it was lymphedema. I'd only heard of it kind of a little bit from providers that this might be a possible consequence. But the more I read, the more I realized that's probably what was going on. I had a lot of swelling and tightness in my jaw, neck, discomfort, very limited range of motion, even opening my mouth was difficult, TMJ issues, and just general fatigue. I was very fortunate in my search to find Angela, a certified lymphedema therapist in Austin, and was able to start treatment with her in April of 2018. At that first appointment, she took measurements and taught me stretches and the manual self-drainage techniques. At another visit, I was fitted for a compression garment. My treatment included lymphatic massage and manipulation to the scar as well. Frequent visits initially, so I was seeing Angela a couple times a week, and then that has since tapered off to every 2 to 3 weeks now. She recommended in the fall of 2018 that I may be a candidate for the FlexiTouch system, and we were lucky that our insurance helped cover that, and I'll show you a picture of that here in a second. So the last measurements that Angela took showed a total reduction of 8 centimeters or 3.14 inches, which is just crazy to me that there was that much swelling. But again, thankfully the treatment has kept that at bay. So the photo on the left, that's not me, but that's an advertising photo I found online. It looks exactly like my compression garment. I would wear that to bed at night, which was in the middle of Austin summer when I first got that, and it was hot and not very comfortable. So I'd wear it as long as I could, and then throughout the day, periodically for an hour or two. And then, as I said, in the fall, I was able to get the FlexiTouch system, and wanted you to see a photo of kind of how the whole equipment looks with the base and the hoses that connect to the neck compression garment and the vest. And that is me in my FlexiTouch. As I said to Angela, once you've gone through what we go through with head and neck cancer treatment, you kind of lose all vanity. So I actually took a selfie of myself in my garb. And as it notes there, the FlexiTouch system is made by Tactile Medical, and I do a daily treatment of 32 minutes. The photo on the left shows about a week and a half after I finished radiation treatment. It kind of shows what my face and jawline looked like at the time. I was thin, but that is kind of the natural facial shape that I have, kind of a prominent chin. But a couple of months later, you can see that the lymphedema was beginning to set in, a lot of kind of puffiness and swelling along the cheek and underneath the jaw and the chin area as well. And just the last couple of photos, I included the one right about the time I started treatment, just to show how my mouth had been affected also by my neck dissection surgery, that some nerves had been damaged. So it took a while to get my smile back, but a more recent picture in November of 2019 with my husband shows that both the speech therapy and stretches and everything I've done for the nerve damage, as well as the ongoing regimen of lymphedema interventions has definitely kept my lymphedema under control. And that's my story.
Thank you, Jacki, for sharing your story. And I have a question for you in a moment. But first, I wanted to let everybody know, what do you do if you start seeing symptoms or start feeling symptoms of lymphedema? First of all, the very first thing you need to do is reach out to your medical oncologist or your surgeon and let them know that you're experiencing some issues. It may not be lymphedema, it could be other things such as an infection or heaven forbid, a recurrence. And so you do need to reach out to your medical oncologist or your surgeon to let them know that you're having these symptoms. And then if they believe it to be lymphedema, they will refer you out to a lymphedema therapist. A certified lymphedema therapist is a certification that makes someone a bit different than just a regular physical therapist or just a regular occupational therapist. It is a certification program that specifically allows someone to treat lymphedema. How you know that someone is certified in lymphedema is they will have CLT behind their name. CLT, Certified Lymphedema Therapist. So definitely your medical oncologist should have a list of how to find someone in your local area. But I just want to clarify that someone needs that specialization in order to treat lymphedema. Now I want to reach back out to Jacki and ask Jacki, when it comes to your exercise program or what exercise was like during your cancer treatment and how it has impacted or affected you, would you be willing to share that a little bit?
Sure. Initially, even though, providers are asking you to get back into an exercise program at some time, I will say it was difficult because the fatigue is definitely an issue. It's hard to kind of drag yourself out of bed when you're feeling tired all the time. But I certainly have tried to, especially more recently, I did have a second metastasis to my lungs, and I've had radiation treatment on those as well. And it seems like that radiation was not quite as hard on my body as the head and neck was. So I've had the strength and the stamina now to really get into more of an exercise program. It's been kind of crazy with the COVID-19 situation. I'm doing a lot of walking videos at home, but they're more of a workout video and some strength training as well. And for several reasons, I think that that's really important. I also have osteopenia, and it's recommended that I do some resistance kind of strength training. So I've incorporated, at least 5 days a week, 40-minute to an hour exercise, and then I do walk outdoors frequently as well.
Thanks again, Jacki, for sharing your story with us. And I would like to thank the audience for attending this seminar and for helping us spread awareness and education about lymphedema and the importance of your lymphatic system. I know right now during COVID, it's hard for people to exercise, and I do want to let you know that there are virtual offerings available online for people. And there's also telehealth treatment options for lymphedema as well. So don't think that just because you're unable to get out into the community family that you cannot receive help at this time. Appreciate your attendance and stay safe and well.